Quite a slow turnout of persons observed on Thursday morning as the Ministry of Health hosted its fourth public health outreach program, this time in Pedmota, St. David. The range of basic services provided included blood pressure and blood sugar screenings, BMI and dental checks, COVID-19 vaccines administration upon request, however, and cancer screening offered free of charge to members of the public. Communications Officer in the Ministry of Health, Kevin Frederick, says it's a strategy geared towards meeting people where they are. It also coincides with this year's vaccination week in the Americas.
One of the main objectives for introducing the vaccine at that level. Now, remember, we would have done a survey, right? And based on our survey, we saw that the senior people in our community, and those who are burdened by underlying conditions, they were all up for taking the vaccine. So there was no better way to meet them in their comfort zone, and so that's why we actually went out there, make it comfortable for them, and they all access the services that we were actually providing.
The program was already rolled out in Gaul, Victoria, and other parts of St. David. Frederick speaks of the turnout and people's reaction to taking the vaccine now that it is brought to them.
Well, we had an impressive turnout, and as I said, it's not the first, but Ingwa was very impressive. We saw persons from different backgrounds and so on, and that was a very good start for Guav. Bear in mind that we are still vaccinating at the various health centers. So what happened in Guav was just like somewhat bumping up what we are accustomed doing. In St. Mark too, St. Mark was impressive as well. We saw quite a number of persons coming from St. Mark.
Army healthcare team of the St. David Health District facilitated the clinic. Clinics will continue in the coming weeks in other parishes, inclusive of Carriacou and Petite Martinique. Christelina John, GBN News.